and welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news. 145 doctors convicted under PCPNDT Act suspended by state medical councils. In the past 8 years, reported cases under the PCPNDT Act have risen from 2,048 in March 2015 to 3,563 in July 2023, while the convictions have also seen a substantial increase from 271 to 713. The data released by the government in the 29th meeting of the Central Supervisory Board showed. The data also showed that licenses of 145 convicted doctors have been suspended by their respective state medical councils. On 18th of October, India's Health Minister Dr. Mandaviya chaired the 29th Central Supervisory Board meeting focusing on enforcing the 1994 PC and PNDT Act to combat declining child sex ratio and sex ratio at birth. CRB improved by 3 points to 907 in 2018 and 2020. Reported cases and convictions under the Act have risen significantly, with 145 doctors having their licenses suspended. The ministry has implemented 11 amendments to fortify the legislation. This concerted effort has led to a reduction in the gender gap and a positive impact on female survival rates, highlighting progress in addressing gender imbalances in India's population. Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below. Indian origin doctor in Bahrain fired over anti-Palestine tweets. The Royal Bahrain Hospital has taken the decision to terminate the employment of Dr. Sunil Rao, an Indian origin doctor, following allegations that he had posted tweets on his social media account expressing pro-Israel sentiments. These tweets came at a time when Israel's military actions against the Hamas group in Gaza had led to a severe humanitarian crisis resulting in substantial loss of life. In a public statement, the Royal Bahrain Hospital cited that offensive nature of Dr. Rao tweets and emphasized that his views and expressions were strictly personal. The hospital asserted that these opinions did not align with the values and stance of the institution. They considered Dr. Rao's actions to be violation of their code of conduct, leading to their decision to terminate his services with immediate effect. Medical Research Panel says Nipah antibody present in bats. The Indian Council for Medical Research has officially confirmed the presence of Nipah virus antibodies in bat samples collected from the Maruthunkara region in northern Kozhikode district. This area had experienced a Nipah virus outbreak that resulted in the loss of 2 lives the previous month. Kerala State Health Minister Veena George shared this information, stating that the ICMR had convened that the antibody presence in bat samples through an email sent to the state government. Her announcement followed her visit to several government hospitals in the affected Hill district. First pill for dengue shows promise in human challenge trial. Johnson & Johnson has reported that its experimental pill for dengue fever demonstrated effectiveness in a small human challenge trial in the US. This pill is a potential breakthrough because there are currently no specific treatments for dengue, which is an increasing health threat. In a trial conducted with the Johns Hopkins Bloomberg School of Public Health, 10 volunteers were given a high dose of the J&J pill 5 days before being injected with a type of dengue. They continued taking the pill for 21 days after exposure. 6 out of 10 individuals showed no detectable dengue virus in their blood, and their immune systems did not appear to respond to the infection over the course of 85 days of monitoring. In contrast, the 5 participants in a placebo group who received dengue injections showed detectable virus levels. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.